In everyone's life, situations may arise where life is threatened, and no one can come to the rescue. One such critical moment is a heart attack, especially when a person is alone. Many naively believe they will have time to seek help or that someone will be nearby to assist. But the truth is harsh. The first minutes are the most crucial, and life depends on the decisions made. Fortunately, even if a person is alone, they have a chance to survive a heart attack if they act quickly and know what to do. This video will cover 7 key steps to take if a heart attack catches you off guard while alone. These steps are simple but vital, and they don't require medical education or special equipment. The main thing is to be prepared and stay calm. Step by step, we will analyze how to recognize the first warning signs, what to do immediately, how to protect the heart from excessive stress, and even what small actions can buy precious time to receive the necessary medical care. It's worth watching to the end because the last steps are what many forget, and they can save a life. Don't wait until it's too late to understand what the body is trying to say. So let's begin. The first and most important thing is recognizing early signs, as this is the first step to saving a life. Most people imagine a heart attack as a dramatic, sharp pain in the chest, like in the movies. However, the reality is that heart attacks often begin with less pronounced symptoms that are easy to ignore until it's too late. Pay attention to a deep, unpleasant pressure or a feeling of tightness in the center of the chest. It may seem like something is pressing, or as if the chest is slowly filling with cement. This feeling may come and go, making you think everything is fine. But if it lasts for more than a few minutes or recurs, don't hesitate. Other early signs include shortness of breath even without chest pain. You may feel like you've just climbed a high mountain, even if you're at rest. Some experience pain in the arm, shoulder, neck, or jaw. Others may feel dizzy, break out in a cold sweat, feel nauseous and weak. In some cases, especially in older people or women, the pain may feel more like pressure in the back or abdomen than in the chest. As an example, consider the story of 74-year-old Richard, who felt a strange tightness under his collarbone, similar to heartburn, while sitting at the kitchen table. Then he noticed that he had difficulty taking a full breath, and his hands began to sweat. Remembering that not all heart attacks start with pain, he took action, which likely saved his life. The body often sends signals before it screams, and when it comes to heart attacks, these signals are the only chance to take action before the damage begins. If you wait for the classic picture of clutching the chest, it may be too late. Therefore, the next time you feel unwell, especially if it's a combination of pressure, shortness of breath, or unusual fatigue, stop. Don't try to push through it or convince yourself that it's just indigestion. Recognizing warning signs is the first chance for survival. They should be taken seriously, even if they seem insignificant, because life may depend on it. Calling emergency medical services immediately is your primary step when you suspect a heart attack. As soon as you feel alarming signs, don't delay. Dial 911. Don't waste time waiting, hoping that the symptoms will disappear on their own. Dismiss the idea of driving yourself to the hospital or doubting the seriousness of the situation. Calling an ambulance is not only the fastest way to get help, it is your most effective chance for survival. A heart attack will not go away without consequences. Every second counts. The longer the heart muscle experiences oxygen starvation, the more serious the damage. Calling 911 starts the rescue process. Trained professionals are already rushing to you, armed with the necessary equipment and medications. They are ready to provide support, including resuscitating you if your heart stops before arriving at the hospital. Moreover, the rapid deterioration often observed during heart attacks makes it impossible to provide self-help. That's why trying to get behind the wheel is one of the most dangerous decisions a person can make. You risk losing consciousness, causing an accident, or, worst of all, delaying the receipt of vital assistance. Allow professionals to come to your aid. Remember the story of 78-year-old Linda. She felt a strange pain in her left shoulder, followed by nausea and a cold sweat. At first she wanted to call her son, but she remembered the nurse's advice. If you are alone and suspect a heart attack, call 911 first. You can talk to family later. That's exactly what she did. By the time the ambulance arrived, her condition had worsened, but the crew was ready to act. They stabilized her on the spot. That call saved her life. You don't need to be sure of the diagnosis to seek help. Dispatchers won't be annoyed if the call turns out to be false. In fact, they'd rather come for nothing than miss a chance to save your life. Keep your phone handy, especially if you live alone. If you feel the onset of symptoms and can't speak clearly, use the emergency call function. Some phones have a shortcut to call for help even when the device is locked. Learn about this feature and use it if necessary. After calling the ambulance, there is a simple but extremely important action that can be taken. You need to chew an aspirin tablet. Don't swallow it whole. It's important to chew it thoroughly, even if your hands are shaking. If you have regular 325 milligrams aspirin on hand, and the person is not allergic to the drug, and is not taking blood-thinning medications that are contraindicated, this simple step can significantly increase the chances of survival during a heart attack. Aspirin has the property of thinning the blood. This helps slow down or prevent the growth of a blood clot that can block one of the coronary arteries, which is the cause of a heart attack. Chewing the tablet rather than swallowing it ensures faster entry of the drug into the body. Studies confirm that this can buy precious minutes, sometimes even enough to restore blood flow before medics arrive. It is important to remember that taking aspirin on an empty stomach is not recommended, unless it is absolutely necessary. However, in the event of a heart attack, the risk associated with blood clot formation far outweighs the possible negative consequences. Also, coated or extended-release aspirin should not be used. If you only have that kind on hand, it should also be chewed. After all, you need to achieve the fastest possible effect. Let's take an example from life. Joe, 72, felt tightness in his chest one morning, radiating to his neck. He remembered the aspirin in the kitchen cabinet. After chewing one tablet, he calmly waited for the paramedics to arrive. Later, the cardiologist told him that this action likely reduced the damage to his heart muscle. This little pill, he said, prevented the situation from getting worse. If a person lives alone, it is important to ensure easy access to aspirin, storing it in a bedside table, kitchen drawer, or even in a wallet. You need to make sure that the expiration date of the drug has not expired. You should also tell loved ones where the medicine is stored so they can help if needed. This simple action may seem insignificant, but it is based on scientific data and is practiced by emergency response services around the world. Chewing aspirin during a heart attack is not just advice, it's a proven remedy. And in those critical first minutes, it can be the deciding factor between recovery and irreparable consequences. Take steps to protect your heart by getting comfortable. After you have called for help and taken aspirin, you have a simple but vital task ahead of you. Stop all movement. Sit or lie down in the safest and most comfortable position you can find. Now is not the time to walk back and forth. You should not pack things or open doors unless absolutely necessary. Any additional physical exertion puts additional stress on the heart, which is already struggling to get enough oxygen. Ideally, you should sit leaning back in a chair with your feet on the floor and your arms hanging loosely. This helps reduce the load on the heart while you wait for the medics to arrive. If you feel weak or dizzy, lie on your side, slightly raising your head. Don't try to overcome the discomfort. This mindset may have been helpful in other life situations, but at the moment it's a risk you can't afford. Often people are embarrassed. Call for help and then sit and do nothing. But make no mistake, doing nothing is also an action. It gives your heart a chance to stabilize. It slows down your breathing and prevents your body from using up its already limited supply of oxygen. Take the story of Alice, who was 81 years old when she felt pressure spreading across her chest. Her first impulse was to clean the kitchen and tidy herself up. But she remembered what her doctor had once said. If you think it's your heart, sit down. Everything else can wait. She sank into her favorite recliner, waiting for help to arrive. That stillness, as she would later learn, likely prevented her symptoms from escalating into full cardiac arrest. So if you ever feel those symptoms creeping in, pressure, shortness of breath, dizziness, don't try to finish what you're doing. Stop right where you are, or move as little as possible to a safer spot. Sit or lie still, breathe slowly, and let your body focus on one task: survival. Here's something simple, yet often overlooked. If you're in a chair without armrests, don't let your body slump. Keep your back straight and your breathing open. The more relaxed and upright your posture, the less strain on your heart. In an emergency, once you've called for help and are calming yourself, one of the most helpful actions is unlocking your front door for arriving emergency responders. It might seem minor, but in a critical situation, every second counts, and a locked door can delay medical attention when time is of the essence. Of course, paramedics are trained to force entry if needed. However, forced entry takes time, can cause damage, and may even startle or traumatize you if you're near the door. An unlocked door allows them to enter instantly and begin treatment immediately. This simple act could save minutes your heart might not have. If you live alone, especially in an apartment or gated community, it's important to think through the logistics before a crisis. Is your door easy to open from the inside? Is your address clearly visible? Is there a spare key someone close to you can access? These questions don't seem urgent until they suddenly are. Consider Paul, a 76-year-old living in a small apartment. When he felt symptoms coming on, he called emergency services, took an aspirin, and unlocked his door, all in under 2 minutes. The paramedics said that action got them to me 30 seconds faster and saved them from having to break down the door, Paul recounts. It's the last thing I would have thought of, but it might be what got me help just in time. If walking to the door feels too risky, don't do it. It's better to stay put and focus on breathing. But if you're near the door and feel stable enough to safely reach it, unlock it. You might also consider a smart lock with remote access or a medical key box, especially if you live alone or have mobility issues. It's a small preparation, but it signals to arriving rescuers, you're ready. You've done what you can. Now it's their turn to do the rest. In a critical situation where immediate assistance is required, your phone transforms from a mere gadget into a lifeline. One of the most effective ways to utilize it is by activating the speakerphone function. This allows you to communicate with emergency services without needing to hold the phone, which is especially crucial when you need to focus on breathing and maintaining composure. Holding a phone to your ear can be difficult to do properly in a stressful situation. Speakerphone not only reduces physical strain, but also ensures better audibility for the dispatcher, even if your condition suddenly worsens. The dispatcher will also be able to hear important details about your condition, your breathing, movements, and intonations. Equally important is the medical ID feature found on every modern smartphone. On iPhones, it's accessible even from the locked screen, and Android devices offer similar functionalities. This feature stores vital information such as your age, allergies, medications, and medical conditions. If you're unconscious, arriving medical personnel can quickly access this data, potentially making a significant difference in your treatment. Imagine Susan, a 79-year-old who lost consciousness before paramedics arrived. Thanks to her configured medical ID, paramedics immediately knew about her diabetes and penicillin allergy. This prevented potential complications. Additionally, they were able to contact her daughter using the emergency contact information listed on her phone. Setting up this information takes only a few minutes and could save your life. Include your name, date of birth, information about any serious medical conditions, medications you're taking, allergies, and emergency contact details. This is crucial for anyone who might find themselves in a situation where they cannot speak for themselves. Therefore, at the first signs of a heart attack, use the speakerphone. Stay on the line and trust the dispatcher's instructions. Their calm voice and support can make waiting for help less frightening. If something happens before paramedics arrive, the phone can speak for you, when you can't. Slowing your breathing to stabilize your heart. When a heart attack strikes unexpectedly, it's easy to panic. Your chest tightens, your thoughts race, and every second feels more agonizing than the last. However, in this critical moment, you have one reliable ally, your own breath. And if you use it correctly, it can calm your nervous system enough to give your heart a better chance to function stably. Controlled breathing is not a cure for a heart attack. Its purpose is to prevent your body from going into shock while waiting for help to arrive. The more anxious you are, the faster your heart may beat. But slowing your breathing can gently bring your rhythm back to normal. You don't need any special techniques to do this. Just try the following. Slowly inhale through your nose for about 4 seconds. Hold your breath for a moment. Then slowly exhale through your mouth for 6 seconds. Repeat this. Focus on this simple rhythm. It gives your body a point of reference and can prevent dangerous arrhythmias caused by stress. Consider the story of 83-year-old Frank. When the pain surged, he felt like he was drowning in fear. But he remembered the simple breathing exercise his doctor taught him during a checkup. He focused on each breath, staying calm and letting go of the panic. By the time paramedics arrived, his heart was still working erratically, but it hadn't stopped. I just kept thinking, stay calm, stay alive, he recalled later. You can practice this breathing anytime, when you're resting, when you're feeling anxious, even when you're watching television. The more familiar it becomes, the more instinctively your body will return to it when the stakes are high. Your breathing won't fix your arteries, but it can buy you time. It can maintain oxygen flow and help your heart hold on. And sometimes, in those last moments before help arrives, that's all you need. Stay calm. Stay alive. In conclusion, surviving a heart attack alone is not just luck. It's the result of preparation, awareness, and cool-headed action. These 7 steps may seem elementary individually, but together they form a powerful strategy that can save your life. You must be able to recognize the harbingers of trouble. Don't delay calling for emergency help. Take aspirin if possible. Assume a sitting or lying position to conserve energy. Try to facilitate access for paramedics. Use your phone wisely and control your breathing to stabilize your heart. Each of these actions gives you a little more time. Each of them gives you a little more control over the situation. And each of them testifies to an important fact. Even when you are on your own, you are not helpless. A heart attack may seem like the scariest form of loneliness. But these steps remind you that you are not without resources even for a moment. You have tools, you have knowledge, and now you have a plan of action. So ask yourself, what stood out to you most today? Was there a step you hadn't considered before, or now see in a new light? Think about how you can put this knowledge into practice, and maybe even share it with someone you care about. It could save not only your life, but theirs.